action. So next we see the dosage of nitroglycerin in angina sublingually and in adult 0.5 to 1 mg dose and repeated as required. So next we see the side effects of this nitroglycerin, and the side effects include throbbing, headache, flushing, dizziness, postural hypotension, tachycardia, paradoxical bradycardia is also reported, and postural hypotension, that means venous vasodilation, headache, meningeal artery vasodilation. So next drug is amyl nitrate, and the general points about this amyl nitrate is it is same as glycerol trinitrate, that means nitroglycerin. Next is isosorbide mononitrate. So we see the some general points about this isosorbide mononitrate. So this isosorbide mononitrate is administered orally, and isosorbide dinitrate is a representative nitrate vasodilator, and various drugs can serve as alternatives. And this isosorbide mononitrate is sublingual tablets isosorbide dinitrate 5 mg. And also sustained release, that means prolonged release tablets or capsules of isosorbide dinitrate is 20 mg or 40 mg. So next we see the uses of isosorbide mononitrate, and the uses including it used in prophylaxis of stable angina and treatment of chronic heart failure. So this isosorbide mononitrate is used in the prophylaxis of stable angina and also in the treatment of chronic heart failure. So next we see the contraindications of isosorbide mononitrates, and the contraindications include the hypersensitivity to nitrates, hypotension, hypovolemia, hypertrophy, obstructive cardiomyopathy, aortic stenosis, cardiac tamponade, constrictive pericarditis, mitral stenosis, mark anemia, head trauma, cerebral hemorrhage, angle closure glaucoma. So these are the contraindications of isosorbide mononitrates. Includes hypersensitivity to nitrates, hypotension, hypovolemia, hypertrophy, obstructive cardiomyopathy, aortic stenosis, cardiac tamponade, constrictive pericarditis, mitral stenosis, mark anemia, head trauma, cerebral hemorrhage, and angle closure glaucoma. So next we see the tolerance of isosorbide mononitrate, and the tolerance include the patients taking isosorbide dinitrate for the long term management of angina may often develop tolerance to the anti-anginal effects. This can be avoided by giving the second of 2 daily doses of longer acting oral presentations after an 8 hours rather than a 12-hour interval, thus ensuring a nitrate free interval each day. So next we see the precautions. The precautions include like severe hepatic or renal impairment, hypothyroidism, malnutrition, hypothermia, recent history of myocardial infarction. So these contraindications and precautions are same as that of nitroglycerin. So and the dosage is in angina, acute attack, and also in sublingually in adult 5 to 10 mg dose and repeated as required. And also in angina prophylaxis by mouth, adults 30 to 120 mg dose daily in divided doses. So next we see the side effects of isosorbide mononitrate, and the side effects are throbbing, headache, flushing, dizziness, postural hypotension, tachycardia, that means paradoxical bradycardia also reported. So at last we see the calcium channel blockers in anti-anginal drugs. So these calcium channel blockers causes the arterial vasodilation and decreases the sympathetic actions on the heart, thus both increasing the myocardial blood supply and decreasing the myocardial workload. So next we see the calcium channel blockers pharmacokinetics. The calcium channel blockers with highest oral bioavailability is amlodipine, and the calcium channel blockers with longest elimination T half is also amlodipine, and the plasma protein binding highest is felodipine, and the least protein binding is diltiazem. and the calcium channel blocker which penetrates the blood-brain barrier and used to relieve the cerebral vasospasma following subarachnoid hemorrhage. It is nimodipine. So next we see the verapamil and verapamil hydrochloride. So this verapamil hydrochloride is sustained release, that means prolonged release tablets are available. Next we see the uses of this verapamil hydrochloride. This is used in angina including stable, unstable and Prince metal and also in arrhythmias. This is used. So next we see the contraindications of this verapamil hydrochloride. The contraindications include hypotension, bradycardia, second and third degree of atrioventricular block, sinoatrial block, sick sinus syndrome, cardiogenic shock, history of heart failure or significantly impaired left ventricle function, even if controlled by therapy, atrial flutter or fibrillation, complicating whole Parkinson's, White syndrome and porphyria. So next we see the precautions of verapamil hydrochloride, and the precautions include the first degree and atrioventricular block, acute phase of myocardial infarction. This avoid if bradycardia, hypotension, left ventricular failure, and also hepatic impairment. And in children, specialist advice only in children, and in pregnancy breastfeeding avoid and grapefruit juice. And next we see the dosage of this verapamil hydrochloride. In angina by mouth and in adults, dose is 80 to 180. In adults, the dose is 80 to 120 mg, not, and also 3 times, it takes 3 times daily. 120 mg 3 times daily usually required in Prince mental angina. So in angina by mouth, adults dose is 80 to 120 mg 3 times daily, and 120 mg and it 3 times daily usually required for in Prince metal angina. So next we see the adverse effects of this verapamil hydrochloride, and the adverse effects include constipation, less commonly nausea, vomiting, flushing, headache, dizziness, fatigue, ankle edema, rarely allergic reactions, erythema, pruritus, urticaria, angioedema, Stevens-Johnson syndrome. So also Stevens-Johnson syndrome is the adverse effects of this verapamil hydrochloride. And also myalgia, arthralgia, paranesthesia, erythromegalia, and increased prolactin concentration, gynecomastia and gingival hyperplasia on long-term treatment with high doses, hypotension, heart failure, bradycardia, heart block, and asystole due to negative inotropic effects. So the adverse effects are most important, and it includes constipation, less commonly nausea, vomiting, flushing, headache, dizziness, fatigue, ankle edema, rarely allergic reactions like erythema, pruritus, urticaria, angioedema, Stevens-Johnson syndrome is major, and myalgia, arthralgia, paranesthesia, erythromegalia, increased prolactin concentration, gynecomastia, and gingival hyperplasia on long-term treatment with high doses, hypotension, heart failure, bradycardia, heart blocks, and asystole due to negative inotropic effects. So next we see the last beta-1 adrenergic receptor antagonist. This beta-1 adrenergic receptor antagonist decreases the sympathetic action on the heart, thus the decreasing myocardial workload, and this is contraindicated in Prince metal angina because these beta-1 adrenergic receptor antagonists are not completely selective, and thus might causes the coronary artery vasoconstriction. So this beta-1 adrenergic receptor antagonist is avoided in Prince metal angina. So the drugs is in beta-1 adrenergic receptor antagonist is atenolol. So atenolol is a representative beta adrenoreceptor antagonist, and this is available in various drugs, can serve as alternatives. So and also the tablets of atenolol 50 mg and 100 mg are used. And also it is formed in injection solution. For injection, atenolol 500 microorganisms per milliliter and 10 ml ampoule. And next we see the uses of atenolol. The uses include myocardial infarction, arrhythmias, hypertension and migraine prophylaxis. So this atenolol is used in myocardial infarction, arrhythmias, hypertension and migraine prophylaxis. So next we see the contraindications of atenolol, and it includes the asthma or history of obstructive airways diseases is unless no alternatives, then with extreme caution and under specialist supervision. And this is uncontrolled heart failure, prenatal angina, marked bradycardia, hypotension, sick sinus syndrome and second and third degree atrioventricular block, and cardiogenic shock, metabolic acidosis, severe peripheral arterial diseases, phacochromocytoma. This phacochromocytoma is unless used with alpha blocker. So next we see the precautions of atenolol, and it includes this atenolol is avoid abrupt withdrawal in angina, may precipitate a worsen heart failure, pregnancy, breastfeeding, first degree atrioventricular block, liver function deteriorates in portal hypertension, reduced dose in renal impairment, diabetes mellitus, small decrease in glucose tolerance, and masking of syndromes of hypoglycemia, and history of hypersensitivity. History of hypersensitivity in increased reaction to allergens, also reduce the response to epinephrine. That means this epinephrine is also known as adrenaline, and also this precaution of atenolol in myasthenia gravis. So next we see the dosage of this atenolol in angina by mouth and in adult 50 mg once daily, and if increase if necessary to 50 mg twice daily or 100 mg once daily. And in myocardial infarction, early intervention within 12 hours by intravenous injection over 5 minutes, and in adults 5 mg, then by mouth 50 mg after 15 minutes. By mouth 50 mg after 15 minutes, and followed by 50 mg after 12 hours, then 100 mg daily. So these doses are when the doctor gives the doses as per required. So these doses can be given as per doctor's advice. So next we see the adverse effects of this atenolol, and the adverse effects of atenolol includes the gastrointestinal disturbances like nausea, vomiting, diarrhea, constipation, abdominal cramps, fatigue, cold hands and feet, exacerbation in intermittence, claudication and Raynaud's phenomenon. So this Raynaud's phenomenon is also adverse effects of atenolol, and also bronchospasm, bradycardia, heart failure, conduction disorders, hypotension, sleep disturbances including